Hey, welcome back. And if there have been two threads going through the chat around workplace mental health at this point, one has been that a number of you seem to be enjoying the opportunity to work remotely. And the other one seems to be that we're working you a little too hard because we didn't schedule enough breaks in this. We're going to have a busy day again tomorrow as well, just to get you prepared. But the fact of the matter is, we try to give you as much content as we can and hope that if you aren't able to be in every single minute of every single session, you'll take advantage of the recordings afterwards. So we just had a great conversation with Matt about worker mental health in general. But now's the time we want to take a deeper dive into the lives of one group of workers, our frontline heroes. The last 3 months have been excruciating, as we've talked about today. So many of us have suffered from varying levels of anxiety, fear, and depression. But no groups had to take on more than our healthcare workers, who are enduring the unprecedented experience of providing modern care during the COVID-19 pandemic. Many have been working increased hours, days, and nights with increased exposure and risk for themselves and their families. And every day they are witnesses to tremendous human suffering, to grief, and to unprecedented loss of life. As we know, this can have a substantial impact on the mental health and well-being of our healthcare providers. But healthcare workers don't always get the help they need. Time's short for them, and just like the rest of us, they often struggle to find a therapist who can see them and who takes their insurance. In addition, although employer resources are often available for many, there are also concerns that the stigma for reaching out for help could have career consequences. With that as a backdrop, the Emotional PPE Project was born. This innovative program gives help and hope to many and has received lots of press. It was recently highlighted on the Today Show. Let's take a quick look.
We are back with a new normal this morning and a serious issue that's affecting the frontline healthcare workers who have been the face of the coronavirus pandemic.
That's right. The emotional toll it's taken on them is being called a public health emergency. But there's an innovative program working to change all that. NBC medical correspondent Dr. John Torres explains.
I just don't sleep well anymore. You just don't know what you're going to walk into, but you know it's not going to be good. And you know people are going to be really sick and you feel helpless.
Kristen Darrow is an ER nurse outside Austin, Texas. The state is experiencing one of the worst outbreaks in the country.
It's overwhelming and it's scary.
For Darrow, her excessive worrying about catching the virus has led to sleep issues and burnout.
This is something that can take away my livelihood and something that I can take home and give to my family.
Her case is not unique. Even before the coronavirus pandemic, healthcare workers were experiencing burnout at higher rates than many other professions. Two recent surveys reveal 62% of nurses and 42% of doctors feel burned out.
Prior to COVID, healthcare workers had disproportionately high rates of suicide, of substance and alcohol abuse, and of mental health issues.
Dr. Saddawi-Konefka is a critical care doctor in Boston, where the pandemic overwhelmed hospitals, taking a major toll on his medical residents.
One of my trainees called me in tears because she had made the really tough decision to send her son to live with her parents in Chicago, but not knowing when she would see him again.
In April, Dr. Saddawi-Konefka and neuroscientist Ariel Brown found an innovative way to help. They created the Emotional PPE Project, connecting therapists directly with healthcare workers in need.
Emotional PPE we see as protection from the psychological effects of the pandemic.
Now, with over 400 volunteer therapists, the project is free and requires no insurance. Most importantly, it works around healthcare workers' schedules and is confidential, so they can avoid any stigmas or repercussions for seeking help.
We need to do whatever we can to break down barriers for healthcare workers to feel comfortable accessing care.
Nurse Darrow, only a few sessions in, is already seeing the benefits of asking for help.
You find once you get starting to talk to someone about this and really work through things that it's helpful.
Supporting healthcare heroes in their fight against coronavirus.
MHA is excited to have Dr. Ariel Brown and Dr. Daniel Saddawi-Konefka, the founders of the Emotional PPE Project, with us today. I recognize those faces now. Yeah. Dr. Brown,
the outfits too.
That's right. In addition to being co-founder on this project, is also an associate director of medical science at Sage Therapeutics. Ariel is a neuroscientist who has done research on the brain around ADHD and bipolar disorder and helped develop the first drug approved for postpartum depression. In addition to the Emotional Ppe Project, Dr. Saddawi-Konefka wears many hats. He's the program director of the anesthesia residency at Mass General Hospital, Harvard Medical School. Daniel is a practicing critical care physician and anesthesiologist at Mass General and the program director of the anesthesiology residency at MGH and oversees 80+ resident physicians. Welcome, both of you.
Thank you. Pleasure to be here.
It's great to have you. Let me start off by saying thank you. What an incredible project. Maybe Ariel, you could take the first question. For those tuning into the event and hearing about the project for the first time, tell us how it came to be.
Yeah, absolutely. I mean, first, before I get into that, I will say thank you to Paul and to MHA for having our tiny grassroots nonprofit in this incredible lineup of the conference. So we really, really are honored. But for the question of how that organization got started, so it really was just a conversation between Dan and me. And as you mentioned, Dan is the program director of anesthesiology residents at Boston Hospital. And he is really dedicated to supporting the well-being and the emotional lives of residents who are at a very, a very raw time in their career. And when COVID hit, that became a giant priority because, it was, it's a hard transition. It always was a hard transition, but going into the battlefield of COVID ICU is like nothing else. So I asked Dr. Dan, my neighbor and friend, how I can help, and he said, what do you think about maybe getting these folks some additional emotional support? And I said, sure, I've got a big network of therapists. Both professional and personal networks. So I reached out and I had a giant outpouring of support. So, throughout this journey of starting this organization and of building, it has become, the sort of hope that I get from it and the lessons that I'm learning are everybody has something to give. And there is a lot of goodwill out there right now. So, it started with me reaching out to therapists sort of running and saying, yes, I want to help these folks who I know are, heroes on the front line. And I've got this skill set to provide emotional support. So I will volunteer my time. And then from there, it really snowballed. I realized that if I was going to, connect these interested volunteers with the folks in need, that we really needed an infrastructure, an organization. And, here we are today in the beginning of September, and after only 4 or 5 months, we have a giant volunteer network across the nation of about, right now, it changes every day, but we have about 450 volunteer therapists that are willing to, they're actually saving time in their practice to give pro bono support and pro bono therapy sessions to healthcare workers in need. So anyone who calls up, there's going to be someone there that can that will see them.
That's just incredible. That's really so great. And Dan, I mean, you're a frontline worker yourself, and I'm not sure everybody appreciated because of the attention that New York got, just how hard this hit Boston in the springtime as well, and the frontline healthcare workers there. So talk a little bit about what the last several months has been like. What's it been like on the ground and at Mass General and elsewhere?
Sure. So we are about 1,000-bed hospital. I think we have capacity for around 110 plus or minus ICU beds. And at our peak, we were close to 180 patients who had COVID and were in ICUs. That means that we had multiple surge units, makeshift units that we were putting together to try to meet the need. In terms of what it was like, I think it's important to consider what we have as a baseline. So the baseline in healthcare is that healthcare workers really don't take care of themselves at all. We have higher rates of depression, higher rates of suicide, extremely high rates of burnout. And as you mentioned, there are a lot of barriers to people seeking help. So when COVID hit, it was we were just primed for a lot of suffering, and you know, it came in a lot of different ways, and I think everyone experienced a lot of different emotions in different quantities. Some of the things that people experienced were uncertainty. It can be quite nerve-wracking, especially when you were staring down the start of a tidal wave, not knowing how big it was going to get and what it would look like. A lot of people had fear for themselves, fear for bringing things home to their families. I myself lived in my basement for a couple months, and I was very fortunate because I had a basement where I could live. I think you saw in the Today Show clip, a lot of my residents, a lot of my fellows had to make the extremely hard decision to send their children away to live with relatives out of state. And couple that with the uncertainty of what was coming, they were doing that, not knowing when they would see them again. Other issues that people faced and are continuing to face are isolation from being separated not only from their family sometimes, but from social networks. I think there's a lot of fatigue that comes into this as well through increased work hours, and also just cognitive fatigue from learning different roles and different ways of caring for patients. There are also things that come from, I'll just call it frustration. We see there are some parts of frustration that I think are for all healthcare workers in terms of maybe it's displacement around institutional decisions and so forth, but frustration also with a lot of what we see in the national scene around maybe people assuming that this is a hoax, or really not understanding because they don't see firsthand the consequences of this, and it's hard to fault them, I suppose, if they don't see it firsthand. But as a healthcare worker who's really giving so much of themselves to fight this, it's hard to turn on the news and see that sort of response. I think another thing that, and this was particularly hard for me, was the grief. We are used to seeing people on some of their worst days, and we can't save everyone. That was certainly the case for COVID. And the really, really tough part, I think, for a lot of people during COVID is that visitation policies make it really difficult to have the typical conversations we would have with families, to give them the updates that we would normally have. We are doing them on Zoom or over the phone. And it really lacks that human touch, which I think is important not only for patients and families, but for us as well. And when it comes to end of life, there's a way that we typically have things, and it's never a happy time, but there's sort of a way you can bring families together. They can spend time with their loved ones. At the peak of COVID for us, and I assume this is where a lot of places around the country are now, there are pretty restrictive policies around how many people can visit. I remember, without going into too much detail, having one patient who it was clear that they were not going to make it, and I was talking with her husband. And at the time, our policy was that one person could come in for end of life. And he asked me, how do I pick which one of my children gets to say goodbye to their mother? And there's really no good way to answer that. So, and forgive me, it's hard to tell that story without feeling it. But you take all of those stressors, the uncertainty, the grief, the isolation, the fear, the fatigue, the frustration, And then couple with that the fact that all of the normal outlets that healthcare workers have, just like the rest of the US right now and around the world, those are gone. We don't have the ability to go to the gym. We don't hang out with friends. It's quite the recipe for a mental health crisis.
I'd like to hear you both on this. It's just, Dan, the picture you've painted just now is just so, emotionally gut-wrenching for me to hear, and for so many. And yet many people think that, they have to keep it together for their patients, many of the frontline workers. So they don't want to take care of themselves first. Do you? I mean, in all of this, self-care becomes really important. So is it hard, both of you, Ariel and Desmond, hard to convince people to take advantage of self-care? And this Emotional PPE Project, how's it making it easier? If it is.
Yeah, so I'll talk a little bit about that. We are, and by we, I mean physicians, nurses, healthcare workers in general, we are notoriously horrible at taking care of ourselves. And I don't just mean mental health, I mean anything. There's the old dogma in medicine where if you cough up a lung, you shove it back in and get back to work. And like I was saying, that sort of, I think, ties into the fact that at baseline, we have extremely high rates of burnout and depression. And, it's a little ironic that though we are so attuned to the symptoms of COVID, most hospitals now have daily symptom screens that healthcare workers have to fill out. Like, are you having a fever? Are you having muscle aches? Because the normal culture is just to ignore those things and go care for your patients. And that's for physical symptoms. The idea that we would then tend to mental health symptoms or emotional symptoms really becomes something that's quite foreign to people. It's quite a culture change. And I think it's something that we're seeing traction with, but it's a huge barrier. I think all too often one of the biggest barriers that faces healthcare workers is that they think they don't need help, that they have these low-level symptoms, they're a little more irritable, or maybe they can't sleep as well, or maybe they're having more wine with dinner, and they tend to just ignore these things. But I think there's symptoms of something that could use help, and I think we've seen some pretty serious cases, in terms of suicide cases that have made national news. But even just way short of that, I think by ignoring the small symptoms, we're not operating at our peak potential. We're not serving ourselves well. So maybe I'll pause there and ask Ariel to talk a little bit about how to answer the second part of your question, how the project is aiming to help break down some of those barriers.
Yeah, absolutely. Thank you for that, Dan. I mean, I think just to add also, I know myself, I have several jobs. I have 2 small children. I try to do a lot, but I know that I cannot do any of it well unless I do my self-care routines. And for me, that's about exercise, and it's about connecting with other people by phone, by Zoom, any way I can that, it's physical distance, but not social distance. That's what I actually heard earlier during the conference, and I really like that. So, and similarly, I think, how can a physician or a nurse or, a home health aide do a better job if they are not taking care of themselves and being the best version of themselves? So I agree that, whatever we can do to break down that culture in healthcare workers of, realizing that it's not actually weak to ask for help. It's actually an act of strength. So what Emotional PPE does is it really makes things as simple and streamlined as possible. So I think that, some people may want to ask for help, but they are concerned about the very real personal, professional consequences that can come from it. They don't have time, energy. I mean, I know I was actually just speaking with someone today who lost their sister, and she's looking for a therapist. And she says, I just have spent so much time on the phone trying to find a therapist. I've given up on trying to find someone that takes my insurance. Now I'm just looking to pay out of pocket. I just need to talk to someone. So, what Emotional PPE Project does is it takes away the barrier of time, of search, of needing to find a match that takes insurance, of needing to find a match that fits the time, the flexible schedule of very busy healthcare workers. There's also the piece that there are a lot, as I mentioned, of sort of personal and professional barriers. So on the personal side, I believe, as Dan, mentioned, there's a lot of fear. And from when we started this program, we've been hearing this word weak, weak, weak over and over. I'll be perceived as weak. They'll think I can't do my job well. I'm not going to be able to take care of my patients well if I let this piece of myself, this sort of, emotionally raw piece of myself out. So, one thing that I think has been a great success, or made the service a great success, is that we are entirely 100% separate from any institution that employs healthcare workers. So, we get the question a lot, well, why don't healthcare workers just use their, hospital EAP services? So these services that are associated with their employment institution, you can just call them up and they'll help, right? Why don't they use that? But the fact of the matter is, healthcare workers don't want to mix their emotional support in their workplace because of this culture that we've talked about, and because of the fear of seeming weak or not being able to do their job. The other piece of it too, and this is actually some ongoing research that Dan and I and others are involved in, are the question of professional consequences. So when a doctor or nurse or any other healthcare worker that's licensed wants to practice, they actually need to apply for a license. So, there are, for instance, for physicians, there's physician licensing boards in each state. And a majority of the states ask questions about mental health history. And it's very explicit in the applications, in many of the applications, that if there is a mental health history, that could impact the ability to get a license, to practice, and to not have that license be limited. I think, what ultimately that does, and what the research shows, is that it discourages people from asking for help, because the idea is, if you go to see a therapist and you, for instance, get a diagnosis of seasonal affective disorder, if you want to be licensed to be a physician in Alaska, you have to disclose that, and it becomes public record. And so why would someone go see a therapist if it could actually end up limiting their ability to practice and ability to really, to continue the career they've dedicated their lives to? So, this is what Emotional PPE does, is it sort of takes all the paperwork of, the sort of paper trail of that I think contributes to the fear out of the picture. So it's really a service that is just, you pick up the phone, you call a physician, they serve you, you call a mental health practitioner, they see you for free, and there's the help.
You've both done a very good job of anticipating, a number of the questions I was going to ask you by really giving some very complete answers about this. And I think clearing up a lot. I'm wanting to thread in a few questions from the audience, as we have limited time here as we go. So I thought maybe at this point I would just turn to one that has come up, and that is somebody who's asked us in terms of thinking of the families and how healthcare workers' families are also affected. Are the families able to receive services through this program as well?
So right now we are in the very beginning stages of the organization, and we are focused on healthcare workers. We have had a lot of people reach out wanting to, that are really in need. I mean, I think, as we've heard over and over throughout this conference, this is an unprecedented time of an epidemic of mental health. It's the pandemic within the pandemic. So, what our vision is that we hope to expand as much as we can. Right now, we have a mission to serve people in healthcare related positions and to advocate and educate about their mental health. I absolutely, if I could serve everyone, if we could serve everyone, we would, and maybe we will. But right now, I think that we've got a system that doesn't serve everyone, and we are sort of a Band-Aid for the healthcare workers, and hopefully other Band-Aids will come up to help serve others. I mean, a new thing is teachers, right? We have teachers saying, I can't imagine the stress of being a teacher or a school administrator right now. So, if you're interested in starting a similar project, I'd love to partner with you. I think right now, Emotional PPE is, we're concentrating on building and then hopefully broadening.
Well, just one question along those lines, Ariel, and then I've got a different one for Dan. But so if you are a mental health practitioner happening to hear this, how would they get involved if they want to be part of that group of supporters and helpers?
Absolutely. So the website, so pretty much everything about our organization is online on our website, emotionalppe.org. And if you are a licensed mental health practitioner interested and available to give pro bono therapy to healthcare workers in distress, you can sign up there. So again, emotionalppe.org. On that website is also with the directory. So if you are a healthcare worker in need, you can go right on the website, emotionalppe.org, and you just find a therapist and reach out right away. And anyone else who's interested in supporting the cause, please go to the website and you can find out different ways.
Great. Hey, Dan, you mentioned burnout before. Somebody's asked if you've got some tips on dealing with burnout. I suspect that a lot of people in our audience today have been feeling some of those measures, maybe as intensely, maybe not as intensely, but feeling them anyway. So, tips for dealing with burnout when people are getting overwhelmed?
I'll give you my best advice, and I'll caveat by saying that I'm not a mental health expert. So this is just a friend to a friend type advice. I think if you're feeling down, talk to people. That's probably the most important thing. Don't think that you are alone, because you're not. And make sure that you discuss the issues with people. And if you need help, try your best to find ways to get help. There are plenty of barriers, but try your best to persevere. In addition to that, get sleep, make sure you're still eating, get outside, get exercise, all of the normal things that you can still do.
Are you guys having to manage state regulations around telehealth and telemental health services? If so, both of you or either of you, could you just help answer some of those questions that have been coming up in the chat?
Yeah, absolutely. So if you go to the website, emotionalppe.org, you'll see that anybody who wants to use it, they will you search a directory by state. So if you live in Louisiana, you click Louisiana and you will find everybody in there that has license to provide telehealth for people that are in Louisiana. So the directory is set up by state with those regulations in mind, in a sort of conservative way, so that it's just state. If you're having telehealth, if you're sitting in Louisiana, the person that you're seeing is licensed to practice in Louisiana.
Great. And Dan, what can employers at health systems do to better support their frontline employees from your perspective?
So I think a lot of them are trying their best. I think recognizing that there are a lot of barriers, and that sometimes solutions may not be within their own institution, and finding ways to support creative third-party things like the Emotional PPE Project are important. I think a lot of programs are setting up peer support projects, which involve training of healthcare workers, and I think that's quite valuable. I think it's a little bit different than getting therapy from someone who's licensed, but I think that is still helpful. And I think what those sorts of efforts do is help combat the stigma that is associated with seeking help that is of the emotional variety. So I think setting those things up, even if they're not heavily used, are strong messages that it's okay to not feel okay with things, and it's okay to ask for help.
What about policymakers? Either of you, Ariel, want to start? Any thoughts about what policymakers could do to make life a little easier?
Yeah, I mean, I think again, like you guys have touched on it today, a number of these pieces. One is extending this flexibility around telehealth, because I mean, seeing somebody having to leave work and drive to see someone in your community that fits your schedule is a huge barrier, not just for healthcare workers. I mean, I know that when personally, I've seen a therapist by telehealth in a phone booth at work, and I wouldn't have been able to see her otherwise. So there's the telehealth piece of it. I think there's also the parity piece of it, which I think we've been fighting for decades, and behavioral health coverage, and making that a priority and making it an equitable coverage with physical health.
I'll add to that if I can, just a little bit.
Yes, please.
One of the things that I think is highlighted by something that Ariel said before is that a lot of people who have trouble in finding therapy because they don't have insurance that covers it, they end up trying to pay out of pocket. But what you end up establishing with that is the differences, the socioeconomic disparities in that the folks who are of means can now get help and those who are not of means cannot. And so I think policymakers who could focus on that would really go a long way. Another thing that could be helpful from a policy standpoint also reflects something that Ariel was saying before, and that is that we actually still have a lot of licensing requirements that aren't really consistent with ADA regulations. They're still asking about mental illness, for example, that doesn't relate to impairment of duties. So if there is a way to lobby for change at the state or federal level for that, those would certainly be helpful.
Really helpful. Our time is beginning to run a little short, so I want to make sure I get to this question for both of you, which I know is of interest to some of the people in the chat, and that is, what are you two doing for yourselves? You both touched on this a little bit, but in these challenging times, what are you doing to help you?
So
Ariel, yeah.
Oh, sure. I mean, Dan, I'll just use Dan's and my friendship as a example. We are very silly people. And we try to have as much fun as possible. And I actually had to sternly warn him put up any funny Zoom backgrounds, or I would, today. So I think, I think Dan and I and in other friendships and relationships try to keep things as light as possible and remember that we still have our full selves in the picture, despite the heaviness of the world around us. So, the strengths that I had before, I still have, even though they're a little bit harder to access. So, I mentioned before too, I'm, like exercise and meditation, self-care, and, friendships. And again, physical but not social distance, I think that's a big piece I'm taking away from this whole conference.
For me, it's all of the above. And then also I use EPPE. So I've met with a therapist a few times, and I found that to be extremely helpful to sort of talk through all the emotions that I was feeling and try to categorize them and help process things as they come in. Another thing that I find extremely helpful is to recognize what I can be grateful for. And there's so much I can be grateful for. I think there's a lot of good around us, and it just doesn't take but a moment to stop and look and recognize it. And I think that helps lift me up when I'm feeling down.
Man, thanks for coming back to gratitude, Dan. That came up earlier today too. And I guess I'm at final question. And final question is, Dan, so what is your favorite Zoom background to use when you're on calls like this? It can't be the one that we're seeing.
Ariel, do I have your permission?
Fine. I mean, we're already.
There you go.
Let's
it's
see
me
it.
as Captain Marvel. Yeah.
Oh, thank you, Paul, for allowing that.
Anybody who was looking carefully at it got to see it.
Yeah.
Subliminal superhero.
Captain Marvel sounds very apt and for both of you, really. Just thank you for what you're doing. These are tough times, and we're always looking to give hope here at MHA. So ending on that bit of a positive note and giving people a chance substantively over the course of this past half hour or so to learn more about this program means a lot. And so thank you very much for doing this for us.
Thank you so much for having us.
Thank you.